Hello, I'm Dr. Michael Shuler. We are going to do a TFCC, debridement plus or minus repair. We're going to use the ConMed handstand as our traction tower, which actually makes it really convenient because it just straps into the stand. It's much easier to put together. One of the really nice things I like about this is the digit traps. They slip on nicely onto the fingers. We're able to tighten them down quite nicely. So we've got the arm into the tower. You want to tighten your straps down here with regards to the forearm strap as well as the bicep strap. Once you get these snug, then you can start working on traction. You can see this arm's a pretty long arm, so you unscrew it here. You lift this upper tower up to an appropriate height. You tighten this down. That'll allow you a little bit of increased length here. Again, still a little loose. So then come set the upper arm to whatever height you'd like. Then you can pull the traction part down, attach your finger straps. We're at about 10 pounds. If you need to adjust that, this is your tensioning knob, fine tuning with increasing or decreasing traction. So another really nice feature of this is the ability to flex or extend the arm and or wrist. You basically push this silver button. It allows you to flex it this way or extend it back this way. It locks into place at whichever spot you want and really allows for ultimate customization. So another way to customize this, really get the tower out of your way if you need to. You can push this button down. It allows you to rotate the arm so that really you can get here. Again, you've got great clearance even without this feature, but another nice feature that allows you to get into the wrist at whatever angle you'd like. One of the really nice things is the wide base that this has. Again, it's very stable. This is not going to fall off. Quite nice to be able to attach the arm here, not have to climb underneath the table to strap it down to the table. We're going to do an arthroscopy of the radiocarpal joint. That soft spot is called your 3-4 portal. It's in between the 3rd and 4th dorsal compartment. I typically, for my working portal, use the 4-5 portal, which is to the ulnar side of the 4th dorsal compartment. If we put a stitch in or repair it, we'll use the 6U portal, which is going to be just ulnar to the extensor carpi ulnaris right there. So first thing we do is typically go into the joint and try and fill the joint with some fluid so that it distends the capsule and allows us better access to the joint. We make an incision in the skin and then use a blunt instrument, typically a mosquito, to get into the joint. Put our trocar in. So we're in the joint. You've got some pink inflammation right there. That's where the cartilage is pulled off the capsule. That area right there is most likely what's causing a lot of his pain. We'll end up doing a little repair on that. We come in usually at the 4-5 portal, which is right here. We come in with our ConMed shaver. We want to get rid of all this inflammatory tissue here. You can see we've now cleaned up all that inflammatory tissue. There's a nice space right there that's allowing some movement in the TFCC. And again, that's typically causing fairly significant pain, causes pain with supination, pronation, as well as weight-bearing type activities. Now we do a single incision repair. We come in with our 18 gauge needle here through the cartilage like so. Use a 15 blade to make an incision right where our needle is. You want to then take a mosquito, spread out the soft tissue so you get a little bit of a deep spot for your knot to ultimately end up. Get a second 18 gauge needle, go in through the same hole. So here's our second needle coming through. Now take a looped wire. Our loop is through the one needle, so we get our loop around our needle like that. Now we take our ConMed 2.0 hi-fi stitch, slide the suture through as far as we can get it, grab the suture. So now you can see here's our horizontal mattress. Pull that tight, that closes down that gap. Now you've got a nice taunt TFCC repair. So 5 throws with this ConMed 2.0 hi-fi stitch. Make sure you pull the skin so that the knot isn't getting anything. So 3 little stitches here, closing up our 3 portals. Releases and slides off very easily. Again, the arm is easily removed from the tower. There's no going underneath the table to undo a strap, which makes the nursing staff exceedingly happy.